Hello everyone. Welcome to our video on coxsackievirus, better known as hand, foot, and mouth disease. This virus most commonly affects children under 10 and often causes outbreaks in schools and daycares. Hand, foot, and mouth disease is transmitted through contact and droplet transmission. This means that the virus can be passed from person to person through contact with saliva, fluid in blisters, or through particles released when a person coughs. Saliva on a child's hands, toys that have been in their mouth, or surfaces that they have touched might have the virus. If children don't cover their mouth when they cough, it can also be transferred to people in close proximity. Children infected with coxsackievirus are contagious about 3 days before symptoms appear, and their saliva and the fluid in the blisters are contagious while symptomatic, usually lasting about a week. However, the virus can remain in the child's bowels for several weeks, so extra caution should be taken after an outbreak when diapering children to prevent reoccurrence. Some early signs and symptoms of hand, foot, and mouth disease include mild fever, fatigue, loss of appetite, and sore throat. These usually appear 3 to 5 days after initially contracting the virus. Next come small blisters in your mouth, along the gums and tongue, and red spots will begin to appear on hands, feet, and occasionally the buttocks. These spots may further develop into blisters, but will usually heal after 7 to 10 days. How do you care for a child with hand, foot, and mouth disease? There's currently no direct treatment for this disease, so all efforts are focused on supportive care and prevention of transmitting the virus. If your child's red spots turn into blisters, do not pop them. Instead, let them dry out, as the fluid inside the blister is contagious. If the blisters in the mouth are causing your child pain, try giving cool drinks and avoiding spicy or acidic foods. If your child has a fever, you can consider giving children's Tylenol, always following the directions on the package. The number one way to prevent the transmission of a virus is simply by washing your hands regularly and thoroughly. If possible, try to avoid touching the child's mouth or blisters. We can also prevent the transmission of the disease by making sure we have clean environments. Proper hand washing is done using soap and warm running water. Vigorously rub hands together for at least 20 seconds, paying special attention to areas under fingernails, between fingers, and your wrists. Rinse and dry hands and arms thoroughly, and turn off the tap with a paper towel or your elbow to avoid recontaminating your hands. Alcohol-based hand rubs are not a substitute for regular hand washing and are not appropriate for infants or toddlers, or when hands are visibly soiled. Hands of children and staff must be properly washed and dried before eating, being involved in food service activities, including setting tables, after sand or water play activities, outdoor activities, contact with any animal, and after using the washroom or changing a diaper. However, we cannot forget about the different places the virus has traveled. Being invisible to the eye, it can be hard to determine what surfaces are contaminated by a virus. According to the health and safety guidelines for childcare, objects such as countertops, sinks, taps, or any other surface that is handled frequently need to be cleansed with a disinfectant on a daily basis. Playmats, toys, and dress-up clothes should be washed weekly. During an outbreak, these should be washed every day. Some surfaces must be cleaned between every use. These include any toy that's been in a child's mouth and diapering surfaces. Here are some helpful tips when dealing with an outbreak in the daycare. Rotate toys so fewer need to be cleaned each day. Immediately set aside toys that have come in contact with saliva to be disinfected. Closely supervise and correct hand washing procedures. Increase the concentration of the solution used to disinfect. Kids with hand, foot, and mouth do not have to be excluded from daycare, but extra precautions should be taken to reduce transmission. Some resources for more information include the Alberta Health Services Health and Safety Guidelines for Childcare Facilities, the myhealth.alberta.ca website, and the World Health Organization Hand, Foot, and Mouth Disease Information Sheet, all of which can be found online. Hand, foot, and mouth disease, while quite contagious, is controllable if the proper precautions are taken. Remember, keep a clean environment and teach kids to wash hands well and often, and cough or sneeze into their elbows. We hope you found this video helpful. Thanks for watching.
created using Powtoon.